Ladies and gentlemen, I'm going to talk today about gestational diabetes. What do I mean by gestational diabetes? Diabetes which is developed during pregnancy. What do I mean by that? Lady, she doesn't know, or she was perfectly healthy. She is not diabetic, but she developed diabetes, I mean high incidence of sugar in the blood during pregnancy. Your question to me now, can I discover that before I get pregnant that I'm going to develop diabetes in pregnancy? The answer is yes. Your question to me is quite clear after that. How? It's easy. First of all, go back to your family history. Is your mother diabetic? Is your father diabetic? Any strong history or family history of diabetes? That's number one. Number two, if you are a mother already, how much was the weight of your baby at the time of the delivery? If it is over 4 kilograms or 3.75, please do the following test to discover if you are going to develop gestational diabetes in your next pregnancy or not. Sometimes you develop the diabetes, I mean the gestational diabetes during pregnancy, and you have had already a big baby, but you don't know that you were diabetic at that time, and you will carry on your life on the normal way without taking any care about the type of food which you are taking, and in very short time you will develop diabetes. I mean, you will be a diabetic lady even without pregnancy. And my advice to you, please look to your family history, to your past obstetric history. Then if you have a big baby before or unexplained stillbirth. What do you mean by unexplained stillbirth? At the 9th month of the pregnancy, everything was progressing quite normally. Then suddenly you found that you have lost your baby before the time of the delivery and no baby heartbeat or fetal heartbeat. In these three circumstances, when you go back to the history, you should have the test, what I'm going to talk about it, what we call it corticosteroid stress test, to put you under the stress of the pregnancy. Exactly if you are pregnant. You are not pregnant now, but you would like to know if you are going to develop diabetes in the future or not with the next pregnancy. You don't like to have a stillbirth again. You don't like to have a dead body, a dead fetus again, or dead baby again. At that situation, what you should do, usually you will go to your doctor, and he will give you a big dose of corticosteroids, and he will do a blood sugar test, what we call it glucose tolerance test. If glucose tolerance test has been changed from normal pattern to an abnormal pattern, under these circumstances we could say that you are very liable to have a diabetes during your next pregnancy. And you should be very careful to see your doctor to regulate your diet before you get pregnant. Now we talked about before you get pregnant. Okay, I'm pregnant, doctor. What should I do now? Okay, it's quite easy. If you are pregnant with a positive family history, like what I said before, I'm not going to repeat it again. One of the very important tests, and usually it is a routine test for all ladies now, is random blood sugar, or a special type of the hemoglobin which is related to the gestational diabetes, a special type of test. If the random blood sugar is normal, or maybe normal, maybe abnormal. If it is abnormal, we don't rely only on glucose tolerance test. We do blood sugar profile. What do you mean, doctor, by blood sugar profile? I mean taking sample of blood prior to lunch, before lunch, and another sample before breakfast, then before lunch, before supper, and at midnight. Not only before and after. But I tried to make it easy related to the time, breakfast, lunch, and the supper. Just before and 2 hours after. Before and 2 hours after each meal, and at midnight. If the blood sugar is abnormal, I mean high blood sugar level, this means you developed already gestational diabetes. I mean you are diabetic with your pregnancy. Treatment usually, if it is a mild degree of gestational diabetes, is dieting only. I mean by dieting, reducing the calories to, it depends about your weight. But usually with the average weight between 1,000 and 1,200 calories per day, and your doctor will tell you how can you divide that calories during all through the day. That's in the mild degree, and usually it is controlled. I mean the blood sugar is controlled, and you can carry on the pregnancy in the normal way. What is the, doctor, can you tell me please about if my blood sugar is high, what I'm worried about? You will be worried about high incidence of abortion, you may abort that baby, or high incidence of congenital abnormalities, you may have an abnormal baby. I don't like to go in absolute details regarding what sorts of abnormalities as well, because the time of the program is not enough for that. But it is enough for you to know that the control of the diabetes mellitus, either before the pregnancy or during pregnancy, it saves you from crying, later on when you will have your baby. Less incidence of abortion and less incidence of congenital abnormal baby. Okay. That is in the mild degree. You said that it is going to be controlled only by diet. What about the moderate and severe degree? If you are well-known diabetic lady, or diabetes is not under control by diet, if you are on oral anti-hyperglycemic drugs, I mean taking oral medicine by mouth to reduce the level of the blood sugar in the blood, please go and see your doctor, because he's going to change that oral, I mean the medicine which is taking by mouth, to reduce the blood sugar level, to insulin, to injection. That's very, very important. Oral medicine, there is a query mark about it. Does it cause an congenital abnormalities or not? We are not quite sure, but better to be in the safe side. Once we go from here, I talked about the complication. Now I'm talking about and we talked about the treatment as well. Now, a lot would like to talk about the delivery itself. If your diabetes is very well controlled, the size of the baby will be okay, I mean with the average size, and we may need to deliver you 2 or 3 weeks before the expected date of delivery. But if everything is very well controlled during pregnancy, and the fetal weight estimation by ultrasound scan is good, we may allow you to be full term, to go for delivery at full term. But you are not allowed to be a post term for a long time, maybe for a few days, but not more. It depends about the serial ultrasound scan, about your blood sugar level, about the fetal monitor, about the level of the serum estradiol in your blood. If everything is fine, we may, and there is a query about it, allow you to go for post-term to past your term. Am I going to have my baby as normal delivery, or it should be by cesarean section? More likely, if everything is going normally, you are going through normal vaginal delivery if there is no other causes for cesarean section, like contracted pelvis or any other cause which is not related to the diabetes with pregnancy. Situation like that in holy months like Ramadan, if it is mild diabetes mellitus, our treatment is diet, This means we have to eat regular diet at certain time by special calories, which will not be allowed to fast. If you are in insulin 2 or 3 doses per day, it depends about short-acting insulin and long-acting insulin. If the time of the injection, it comes in the midday, and you should eat straight after the insulin injection, what do you expect? Of course, you are not going to fast. But I would like to warn you, if you have got any irritability, if you feel nervous, suddenly when you are in treatment like insulin or something like that, if you go through a coma, my advice to your relatives, straight test your urine for any sugar in the urine or any ketones bodies. And if you don't have any facilities to check, and you are already in coma, hypoglycemic coma, which is maybe high dose of insulin, which reduced the blood sugar level very, very, very sharp down. Situation like that, it may kill you. I think the treatment is quite easy. If you give sugar, either by mouth or through the drip, you will find that straight the coma is over, if it is hypoglycemic coma, and you are awake again and fully conscious. But usually hypoglycemic coma is irritable coma. First you feel nervous around everybody. You know, situation like that is very, very dangerous, okay? But if it is hyperglycemic coma, I give you blood glucose, but at the same time, you know, I give you glucose and you are hyperglycemic, it will not kill you. But at least we can check the blood sugar level, then we can increase the level of the dose of the insulin, and they will be back to normal. Thank you.